Hello, welcome guys. My drug information is cocaine, and I'm excited to teach you guys about it. Cocaine is a powerfully addictive, psychoactive, and stimulant drug, and not also is an illegal stimulant, but it sometimes is used for local anesthetic for small procedures. It is an isolated chemical from the coca plant. People use it in many different ways. They snort the cocaine powder through the nose, or they rub it into their gums. Others dissolve the powder in the water, and inject it into their bloodstream. Or there's more intense ones like having multiple drugs into one, like a combination. This is called speedball, which is more dangerous for your health. And what I found interesting in researching and reading about cocaine was that there's different areas about it, which is three. In 1985, crack became widespread, which also I found interesting was the first description of coca was in 1499 by an explorer. And the second era, it was used for scientific techniques to determine the dangerous effects of it. And the third era, which was between the 1980s, where people started to glorify the drug, like movies and stuff, and didn't see the true effects of it. And then in 1990s, it started becoming less and less. But before, it was one of the most high-use drug. And here I added some graphics. And the left side, you can see how it looks, and then there's the side effects of chronic use of cocaine, um, and also you see the different effects about it. Like in the brain, it is increased risk of strokes. In nose, there's many discharges and so forth. There are also major effects of cocaine. For example, it stems from enhanced activity of dopamine and adrenaline and serotonin transmitters, meaning in the CNS it has antidepressants. And some people also have severe depression or negative symptoms of schizophrenia. There is also physical and mental performance, which is like easily fatigued and having major sleeping issues. And also, cocaine has innate reinforcing properties that encourage continual use and dependence. There are also many effects of the body. For example, the cardiovascular system, which just causes vasoconstriction, meaning it leads to damage to other tissues, stroke, lung damage, and so forth. I put a description about the withdrawals of cocaine, and it's pretty intense because in the first phase, there's binging. In the second withdrawal phase, there's also anxiety and obsessed with drug seeking. And then the third phase um, is like the last binge, is like cravings and mood swings. The recovery is very tough as well, and there's no effective treatment, but there's also many research about therapeutic agents that seem to help drug users. There's also a last graphic describing the use of cocaine and how it has dropped in the last couple of years. Thank you.